Welcome back to Live on Lakeside. So our next set of guests are going to tell you how their team can literally deliver the smile that you desire, because there's nothing more important than being comfortable in your own skin, and it starts with your smile.
It's the first thing people see.
Yes.
So please welcome cosmetic implant dentist Dr. John Heimke and master ceramist Pinhas Adar. Welcome back.
Thank you so much.
We've missed
We
you.
love you guys.
You know how much we love you.
So for those who maybe are new to your faces, tell everyone how you guys kind of work as a team to really deliver that smile that your client desires.
Absolutely. I'm actually located in Atlanta, Georgia, so we have lots of technological advancements that we communicate together, which is amazing with with FaceTime and Skype and all the other stuff. So we constantly communicate that way. But patients find us from Instagram, from social media, which is powerful. And some of the patients that we're going to share with you today actually approached me, found me on the web, and found research all the zirconia restorations all over, and wanted us to do it. So he approached us and said, hey, who's your doctors in my location? So I actually referred two dentists. One of them was John. So he checked both of them. And the beauty is that, you don't have to make a decision with one. I always give two names because you may never connect with the person. And he connected with John because the human touch. And that's the key, because we have a system. Especially with implants, we know exactly what we're going to get. And that guy was looking for specifically what he saw in pictures and all the posts that we do. And that's amazing that patients can find us that way.
I mean, really, it's not only locally, it's nationally.
That's right.
Obviously.
I mean, it's not, people think, oh, I'm going to be just in your little town. Well, actually, with the internet and with the power of social media, people can find the professionals that they desire. And it is an interview process. I mean, we're doing something that it's very intimate. It's in an area of the mouth or the face that, we're in that zone.
Yeah.
And people have to feel comfortable with you. Obviously, we're passionate about our work, but it has to be a kind of a meeting of minds between us and the patient.
Sure, that makes sense.
So, Pinhas, here's my question then. How do you work with Dr. Heimke with his digital smile project? How do you make that into reality as the oral design at the Oral Design Center?
So when we get digital reference points, basically the design, it's only two-dimensional, so we convert it to three-dimensional. And then we do a test drive of that version, what we mill it or whatever we do it with, and then we send it back to him. He tries it in the mouth, make sure everything functions, looks good, in harmony with the lip, with the face, with eyes. I mean, everything has to be balanced. And then he sends that back to us, and then we copy that in zirconia. And that's the key. And the human touch in what goes in the laboratory, that's the key also, because zirconia, everybody talks about zirconia. In fact, there are some patients who want to find out exactly what kind of material we use. They go to a doctor, and some doctors tell them, oh yeah, my laboratory does the exact same thing like Adar laboratory, and then they get disappointed because they never look like the way we do it.
Yeah.
So it's the human touch that they're missing. And so, well, my pink doesn't look like the way your pictures look. I say, absolutely, we didn't do it. We have a special way, recipes that we do it, and that's the key. And John knows exactly what he's going to get every time.
The key thing is in this teaming is that Pinhas knows that I'm going to design the smile. I have my vision in my brain, and I have to be able to translate that into a visual form so that in his brain he can then take that and take that design exactly through the whole course of treatment. So and that's a lot of things. In the old days, they used to change treatment all the way through, and it made things take a long time, and they weren't as accurate. But now we're so accurate. So I look at the face, then I take that digital smile design app, and I design that smile. It's like an architect's blueprint, and then I send it to Pinhas with the models, and then he translates it for me, and then I finalize it in the mouth at delivery.
If the grilled cheese is just about to go on the stove, hold it, because I want you to look at your television, and we're going to kind of show you the process here. So talk us through what we're seeing.
So this gentleman, actually the one that actually approached us, found us in a website and say, who is your doctor? Because he actually spent lots of money to get those implants. You see how bad they look, and the position and the holes between the implants and the restoration. He didn't like the design, didn't like the way it looks, it didn't function good. So he says, oh, can you help us? I want whatever you show on social media. I said, absolutely. So that's the guy we referred to different doctors.
And here's the before. Look at that result. Isn't that something? But that's looking at the face and designing from the face, not designing from the inside and saying, I'm just going to make teeth and I'm going to forget about the face. So I look at the face first. His oral design group starts with the face also. So we're in a meld right there. We're both in the same sink. And then we carry that through the the process. So, and look at, this is at delivery, the patient's seeing his smile for the first time. It's an unveiling, literally. And you can you're not hearing what he says, but you can see it in his eyes,
look at his
what's
eyes,
happening.
yeah.
He's so happy.
Yeah, and it's so emotional to see this happen, and he doesn't look like a 20-year-old. He doesn't want to look like a 20-year-old. He just wants to look like a vibrant person of his age group, And I have to say, all of us look better in white teeth. I mean, I have 22 veneers here, and my teeth were yellow and crooked, and we all look better in white teeth. And if you're going to do this, you might as well get nice white teeth.
Yeah. But I think the most important thing for patients to know that watch this is say, hey, listen, I go to my own dentist. I don't need John. I don't need these guys. They can do exact same. It's not true, because make sure you find out what your dentist is really capable of. Find out exactly what kind of work they've done. If you like what you see, then stay with them. But it's not all things created equal. You can't judge the tree by the fruit it bears, not by it talks about. Right? Yeah. It's the same thing. So you have to know what you get.
And it's a dynamic process.
Yeah, absolutely.
We interview the patients very in-depthly. We take video, we take photographs, and it's a dynamic process. So each time we're going through the case, we're actually fine-tuning just a little bit to make it even better and better. And then finally, the end result is hopefully a beautiful, vibrant, natural smile.
You're so good at what you do. We want to get you all the information at home so that you can get in touch with these brilliant smile makers.
Yes, they're artists to the fullest extent. They're located right on Center Ridge Road, Suite 302 in Rocky River. You can call 888-255-3588. You can also go to everyonelovesmysmile.com or dentalimplantsrockyriver.com.
So good to see you.
Thank you, guys. You guys are awesome. Thank you.
Smile on. Yes.